Hello, everyone. As we wait for everyone to join, if you could please select the interpretation button at the bottom of your screen and select the language you want to hear. Um, Please select English and not the original audio, even if you want to listen in English.
Olá a todos. Enquanto a gente está esperando algumas pessoas entrarem, se vocês puderem entrar no canal de português, aqui no botão de interpretação. Então, você só precisa clicar no botão de interpretação e selecionar a língua que você prefere, e você vai ouvir o evento inteiro sendo traduzido simultaneamente.
Hola a todos, bienvenidos a la edición del 2021 de Voces Latinoamericanas de la Política. Antes de comenzar, quiero pedirle que seleccione el idioma que desee y el botón de interpretación en la parte inferior de la pantalla. De esta manera podrá escuchar la traducción de todas las conferencias simultáneamente al idioma que seleccione.
Okay, so I think we can get started.
Now that you're all hopefully connected to the translation channels, we can begin. It's an honor for us to welcome you all here. My name is Isa Calero. I'm Ecuadorian and Colombian, and I'm currently studying international relations at Stanford University. I'm the co-founder and co-chair of Latin American Voices in Politics.
And my name is Melissa Oliveira. I'm Brazilian and I study political science at Stanford. I'm also the co-founder and co-chair of Latin American Voices in Politics. And in this opening ceremony, we want to introduce you all to LVP and also to the Pan American Health Organization and Dr. Etienne, who will then give her keynote speech. After that, we'll give a brief overview of all the activities we have planned for the conference and the logistics. So Latin American Voices in Politics is a series of conferences from students for students that aims to promote dialogues about the future of Latin American Caribbean public policy, led by specialists in the field. And this year, we chose to focus on public health policy.
Before we tell you more about why we decided to create LVP and introduce you to our amazing keynote speaker, Dr. Carissa Etienne, we wanted to thank all of the people that made this conference possible.
This wouldn't be possible without our core team that you will get to know throughout the panels. We also want to give a special thank you to all of our student ambassadors who are essential in spreading the word about the conference throughout several universities in Latin America. We're also extremely grateful for the Stanford Society for Latin American Politics, which is our host, and to all of our Stanford sponsors, the McCoy Center for Ethics and Society, the Center for Economic Policy Research, the King Center for Global Development, the Haas Center for Public Service, the Center for Innovation in Global Health, the Center for Latin American Studies, the Center for Poverty and Inequality, and the Public Policy Department. Also, special thanks to our faculty advisor, Professor Roberto Diaz, and a huge thank you to all of the panelists that agreed on joining us this weekend.
For the inaugural conference of Latin American Voices in Politics, we chose to focus on public health policy because this past year has been a time of loss and unprecedented challenges for the world due to the COVID-19 pandemic. Worldwide, there have been over 4.3 million deaths, and more than 1 million of these deaths have been from Latin America and the Caribbean. There are only 652 million people in our region, or only 8.4% of the world population, yet 26% of these deaths have been from our region. This sad reality has been weighing on us, as a lot of people in our audience, since the pandemic started. As young students, we experienced frustration with the helplessness of the COVID-19 health crisis and the subsequent political instability and exacerbated inequality and poverty that many countries experience. There is no time like now to look towards public health, to reevaluate what needs to be done to prevent this from happening again in the future.
And the idea for this conference surged from this frustration and our desire to help. We believe that the only way to reduce all inequalities and achieve structural economic and political development in Latin America and the Caribbean is through public policy. To achieve this public policy, it is necessary to consider the needs of populations that are usually overlooked, choose research-based policies that actually have an impact, and implement them effectively. It is fundamental to include young people and students in these dialogues because they will be the future researchers, the future politicians, and the future third sector agents impacting public policy.
Having dialogues between different countries and sectors is a core aspect of our conference because we believe that collaboration between countries in our region and the private, public, and non-governmental sector is fundamental for the development of effective public policies in our region. In each of our panels, we hope to bring three main perspectives. One, comparative research that looks at different public health policies in the region from the perspective of different researchers throughout Latin America. Two, implementation and administration of public health policy from the perspective of policymakers and government officials. And three, the necessities and impact of public health policies on different communities through the lenses of community leaders and third sector agents. We hope to bring these perspectives in our four panels: healthcare systems, health inequalities, maternal and reproductive health, and vaccination plans.
And joining us in our audience today, we have people from 34 countries, and 80% of our audience are students, but we're also joined by professors and public health workers.
We are also delighted to welcome our esteemed panelists, which come from 10 different countries and include representatives from 3 multilateral organizations, as well as 2 current ministers and 1 former one.
And one of the multilateral organizations we have represented in this conference and that is essential to health policy in Latin America and the Caribbean is the Pan-American Health Organization, which is the specialized international health agency for the Americas. Since 1902, under the leadership of its 51 member countries and territories, PAHO sets regional health priorities and mobilizes actions to improve and protect people's health.
The mission of the Pan-American Health Organization is to lead strategic collaborative efforts among member states and other partners to promote equity in health, combat disease, and improve the quality of and lengthen the lives of the peoples of the Americas. The vision of the organization is that by 2030, the region as a whole and the countries of the Americas aim to achieve the highest attainable standard of health with equity and well-being for people throughout their life course, with universal access to health and universal healthcare, resilient health systems, and quality health services.
What does PAHO actually do? So PAHO has 6 core functions working alongside governments and other institutions throughout countries in the Americas. The first one is to shape the research agenda and stimulate the generation, dissemination, and application of valuable knowledge about health policy. The second is to articulate ethical and evidence-based policy options. The third is to establish technical cooperation, catalyze change, and build sustainable institutional capacity. The fourth is to provide leadership on matters critical to health and engaging in partnerships where joint action is needed. The fifth is to set norms and standards and promote and monitor the implementation of these norms and standards. And the sixth is to monitor the health situation and access health trends throughout the region.
During its 110 years of history, PAHO has had many accomplishments, among them a 35-year in average life expectancy since 1902, the eradication of smallpox and polio from the Americas, and the elimination of endemic transmission of measles, rubella, and congenital rubella syndrome, and many others.
There is no one better than Dr. Carissa Etienne to tell us more about this accomplishment and the extremely important role of PAHO. She is the Executive Director of the Pan-American Health Organization and was elected for a second 5-year term in 2017. And from 2008 to 2012, Dr. Etienne also served as an Assistant Director General for Health Systems and Services at the World Health Organization in Switzerland. And prior to that, she was the Assistant Director of PAHO from 2003 to 2008, where she led 5 technical areas: health systems and services, technology, healthcare and research, health surveillance and disease management, family and community health, and sustainable development and environmental health.
Dr. Etienne is a lifelong champion and crusader for primary health as a driver for equity in health and development. A native of Dominica, Dr. Etienne received her medical degree from the University of West Indies, Jamaica, and her Master of Science degree in Community Health in Developing Countries from the London School of Hygiene and Tropical Medicine, University of London, United Kingdom. Dr. Etienne is a huge inspiration to anyone who is interested in working in public health policy and to us on a personal level. She has had amazing accomplishment during her life directing PAHO and fighting for equity in health. We are extremely honored to have you as our keynote speaker. Welcome, Dr. Etienne.
Thank you so much, and thanks for this kind introduction. And let me greet your professors and healthcare workers, ladies and gentlemen, and students and future policymakers and influencers of public health policy in our region and the world. Thank you for the invitation to share on effective health policy, the process and the important health policies which have shaped the health and well-being of the peoples of the Americas, a region which is both heterogeneous and unequal. I readily accepted this invitation because I was overjoyed that you, the youth, our future, is eager to fully engage in a topic that is so central to the quest of health for all. As you would have listened in my career, I have been fortunate to be involved in and to lead the development and implementation of public health policy at all levels, national, regional, and global. And thank you for introducing the Pan American Health Organization. And I just wanted to add one or two more facts. We, of course, an international organization, and as you heard, we were founded in 1902. PAHO serves as the regional office of the World Health Organization since 1948, when WHO was established. So we are older than them. But we also are the regional office, where we did say for the Americas at WHO. And because we are, therefore, we are also a member of the United Nations system. I think that's important to note. And we simultaneously serve as the specialized health agency of the Inter-American system, along with the Organization of American States and the Inter-American Development Bank, IDB, among others. So PAHO is uniquely placed to influence health policy at the United Nations, Inter-American level, sub-regional levels, the global and national levels. And so with our 35 members and territories, we lead and facilitate this, this policy framework. The Pan American Sanitary Bureau is the secretariat of the Pan American Health Organization. And so from our headquarters in Washington and our country offices throughout the region, we provide technical cooperation on a variety of issues, as you heard described in the brief. Initially, in the early years, the Pan American Health Policy was focused on yellow fever and other infectious diseases that were being spread by the growing maritime commerce of the late 19th and early 20th centuries. And you know, that was mainly driven by the economic losses that they faced because of this outbreak of diseases. And in November 1924, the Pan American Sanitary Code was developed. It was signed then by 18 countries of the region, as we call them, republics in Havana, Cuba, and later was ratified by all the republics of the Americas. It is interesting to note that the sanitary code remains in force today. And the code built upon the practice of quarantine that was applied by the Port of Venice in the 14th century. But it is also an emergency regulation applied not only to control ships arriving at port, but also in cities to stop the spread of the disease, oversee the sick, protect the healthy, disinfect homes, and bury the dead. The segregation of lepers and their banishment from cities was also an important aspect of this model. And as I described that, you can begin to hear the trappings of what we're using now, even in this 21st century, to deal with the COVID-19 crisis. So for 119 years, PAHO has developed joint public health policy, and we've fostered this Pan-American cooperation that led, as you well mentioned, to major regional health achievements. So yes, we've seen a gain of 35 years in average life expectancy since 1902, the eradication of smallpox and polio from the Americas, the elimination of endemic transmission of measles and rubella, major reductions in infant mortality, And other regional public health achievements like disease eliminations, the significant expansion of health coverage for poor and vulnerable populations in the Americas, progress in legislation, regulations, and fiscal measures to reduce the risk factors for communicable diseases. The ratification of some 30 of 35 countries in the Americas of the Framework Convention on Tobacco Control, the FCTC. In Latin America and the Caribbean, the highest rates of coverage with antiretroviral treatment for people with HIV of any middle-lower income region. And of course, increased access to affordable vaccines and essential medicines through our revolving fund for vaccines and the strategic fund. So I have chosen to start by sharing some of the public health achievements in the Americas because effective public health policy is about improving the health and the well-being of people, reducing inequities in health, addressing the specific and differentiated needs of people, and it is about addressing the remaining and new public health challenges in a constant quest for health for all. Effective public health policy is enabled by the convergence of different frameworks of different stakeholders, national, sub-regional, regional, and global, and it requires negotiation and diplomacy towards consensus building. Of course, it can be time-consuming, and it must be accompanied by transformation of organizational architecture, leadership, and stewardship of health authorities, and of course, a clear vision, values, and principles. Health policy in Latin America is enunciated by governments, we need to stress that it's not the secretariat, but it is the member states who enact health policy. So it is done in WHO and PAHO primarily, but also happens in the United Nations, the Organization of American States, and sub-regional integration organizations. So like CARICOM in the Caribbean, SICA in Central America, OTCA in the Andean subregion, and previously UNOSOR, NOPROSOR, and CELAC, which is an organization for all of Latin America and the Caribbean. So interesting to note that PAHO is the only organization where all the countries and territories in the Americas are members. So we also sit uniquely. All of the others have left out a few countries. I wanted to just for a moment look at some of the UN declarations which have significantly impacted health. And the first of those is the UN Declaration on Universal Human Rights in 1948. And from this emanated the right to health, which is enshrined in the WHO Constitution to which you referred. Also, the Convention on the Rights of the Child and the Rights of Indigenous Peoples. These have framed public health policy for many, many years. The first UN General Assembly political declaration or resolution on a health-specific topic was in 2001, and it was on HIV/AIDS. And later we saw resolutions passed on NCDs, universal health coverage, and COVID-19. If you will recall, the UN Millennial Declaration in the year 2000, that was followed by the Secretariat of the UN, the definition of the MDGs, that was important in catalyzing health policy in the region, in HIV/AIDS, TB, malaria, maternal health, child health, neglected tropical diseases, and improvement in access to water and sanitation and nutrition. And that was followed by the UN SDGs, the Sustainable Development Goals. This time, those goals were defined by the member states and listed a specific health goal, and that's SDG 3, ensure healthy lives and promote well-being for all at all ages. However, let's note that all other goals contribute to health and well-being, given that health is so intrinsically linked to economic and social development, environment, and social determinants. So Let's first affirm that health is not a privilege nor a commodity. Health is a fundamental human right. And in 1948, the member states of WHO agreed on this principle. The enjoyment of highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. This right has also been recognized by the United Nations and regional organizations, the Organization of American States, and addressed in many international instruments, such as declarations, standards, and technical guidelines that provide important guidance that member states use to develop their national policies. And the right to health is enshrined in the constitution of 20 of our PAHO member states. It is really based on this core value that the world came up with the vision of health for all more than 40 years ago and developed the concept of primary health care, which has been the foundation of health systems transformation and public health policies in the region and in the world. The unprecedented Declaration of Alma Ata in 1978, endorsed by representatives of health and development sectors, was a call to action to respond to inequality and cemented the issue of health as a human right. 40 years later, we saw in Astana in 2018 that the call for action was sounded again. And now in the COVID-19 pandemic, it is even more relevant today. So the 1978 Alma Ata Declaration and the subsequent regional resolution based on this represents for us the North Star that allows us to guide the transformation of public health policy to address current and emergent challenges. So you will agree with me that we have an unfinished agenda, which is central to the development of public health policies. In recent times, PAHO member states have adopted important strategic policy frameworks to respond to the needs and the challenges of health for all in the 21st century, including among them the Strategy for Universal Access to Health and Universal Health Coverage, the Sustainable Health Agenda for the Americas 2018-2030, and that was approved in 2017, and the Strategic Plan of the Pan American Health Organization 2020 to 2025. Also, a resolution on equity at the heart of health was approved in 2019. The Strategic Health Agenda for the Americas 2030 establishes a hemispheric vision for health based on the SDGs in the Americas. So these policy frameworks all recognize, along with the right to health, other guiding values as equity in health, solidarity, including Pan-American solidarity, universality, and social inclusion. So in this context, leaving no one behind is a transformational principle to achieving the SDGs. And it's also the axis of the strategy for universal access to health and universal health coverage. So regional policies guide the development of other complementary policy frameworks at the sub-regional and national levels. So PAHO has a well-established sub-regional program. And the added value of that program is to support the sub-regional integration mechanisms with evidence on important emerging health issues, and importantly, to foster policy cohesion. And this is very important for the region. They sit at the regional level, and in PAHO, they make decisions, and at the sub-regional level as well, they make policy decisions. So we sit in between those and to help them with policy cohesion. So it's also important to note that in Latin America and the Caribbean, national health policy must be incorporated into law by the Congress or Parliament. And so in this regard, we support countries through our PAHO country offices and our health legislation team as necessary to ensure that they can get those policies passed in their parliaments and Congress. So in the last 20 years, the governing bodies of PAHO adopted numerous policies, strategies, and plans of action. I just wanted to visit very quickly some important ones that are relevant to us right now. So in the area of communicable diseases, we have resolutions on HIV, AIDS, and STI that were passed 2006, 2015, and again 2016, 2021. We have resolutions on immunization in the Americas, a PAHO disease elimination initiative, and a policy for an integrated, sustainable approach to eliminating more than 30 diseases and conditions by 2030. Very important. And in 2021, we had resolutions on One Health, a comprehensive approach for addressing health threats at the human, animal, and environment interface. In non-communicable diseases, some of the important resolutions are on the control of non-communicable diseases, the harmful use of alcohol and psychoactive substance use, on road safety, on strengthening the capacity of member states to implement the provisions and guidelines of the WHO Framework Convention on Tobacco Control, on mental health, on disability, importantly, on front-of-package labeling as a policy tool for the prevention of NCDs in the Americas. In the area of determinants of health and healthy life course, health in all policies, there was a resolution on that, recognizing the multi-sectoriality of the response. Health services access and utilization for LGBT persons in 2013. And of course, we have resolutions on child health, maternal mortality, and severe maternal mortality, morbidity, active and healthy aging, gender equality, adolescent and youth health, and health of the indigenous peoples. Those are just a few of some of the important resolutions. In the area of health systems, of course, the landmark resolution on universal access to health and universal health coverage in 2014, health-related law in 2015, social protection in health, access and rational use of strategic and high-cost medicines and other health technologies in 2016, human resources for universal health, quality of care, resilient health systems, and post-COVID-19 pandemic, and also the increasing production capacity for essential medicines and health technologies. These last two are currently going through our governing bodies cycle and are direct responses to COVID-19 crisis. Of course, in the area of disaster preparedness and response, the disaster risk reduction, the international health regulations, which have proven to be very important and central to facing epidemics and pandemics, and of course on COVID-19. Important in the area of health information, we've had a regional plan of action for strengthening vital and health statistics, improving information systems for health, and this year, going through our governing bodies is the digital transformation of the health sector of the Americas and the policy on the application of data sciences in public health using artificial intelligence and other emerging technologies. So there are many resolutions and mandates, and every year we get additional ones being developed, and we sunset. Some are sunset by member states. But all of this is to be able better to respond to the evolving needs of countries and emerging situations. And these policies are then translated into action through our planning and budgeting processes, allocation of resources, including human resources, prioritization, and of course, joint monitoring and evaluation, the Secretariat and member states. So to do that, the organization has established structures and processes. So policy development in PAHO is the responsibility of the governing bodies, which comprises all member states, one country, one vote. And it includes the Pan American Sanitary Conference, which occurs every 5 years, the Directing Council, and the Executive Committee. The auxiliary advisory body to the Executive Committee is the Subcommittee on Program, Budget, and Administration. The Secretariat is responsible to facilitate the policy development process, with evidence gathering, analysis, technical expertise, and coordination of multi-sectoral consultative processes. Of course, it sounds very simple on paper, but it is not that simple in action. There are many things taking place behind the scenes. And let me just share with you one such experience that probably best illustrates it. So when we were developing the plan of action on the strategy and plan of action for universal access to health and universal health coverage, this was reaffirmed by the commitment to universal health coverage at the 52nd PAHO Directing Council in 2013. And they gave us the mandate to prepare a strategy and plan of action to be presented to the 53rd Directing Council. So the Secretariat supported a broad consultative process for developing the strategy for universal health coverage. And that was to promote a broad-based participatory dialogue on the issue and to identify not only problems and obstacles, but innovative approaches and solutions that would allow the region to advance towards universal health coverage at the time. So we held 31 consultations in 31 countries, some 1,300 participants, and this consultative process included open, transparent participation of academia, civil society, and social networks. But also it included people living in conditions of vulnerability. That was extremely important for us. So out of this process, we had a series of contributions which really enriched the strategy document and identified country-specific needs. There was really an active, enthusiastic engagement of the national authorities and PAHO country offices in the process, culminating in a formal member state working group. So we had many meetings of this working group. The discussions were intense, but this led to a strategy not merely for universal health coverage, but all member states insisted to include universal access to health and universal health coverage. And you could see them in the working group meetings, almost word by word negotiation in and outside of formal meetings, and the consultation with their countries, capitals, and this negotiation intense. So this was health diplomacy at its best, with member states playing a critical role in negotiations, in consulting with their leadership, etc. But this helped us to reach consensus well prior to the formal governing body meeting, because we try to work towards consensus in our governing bodies meetings. So these consultations and member state working groups is extremely important, that we do not have all the discussions happening on the floor of the governing bodies meeting, but very importantly that we incorporate the totality of the expertise and the participation of all countries. So that was quite an experience. I remember at the time when they passed this, I was overjoyed, as you can well imagine. But in addition to these formal processes and mechanisms, PAHO establishes commissions from time to time with participation of academia, practitioners, civil societies, and as I said, persons from vulnerable groups. And what they do is analyze regional issues and provide recommendations to member states. Two important examples in the last 10 years include the Commission on Equity and Health Inequalities in the Americas and a high-level commission on universal health in the 21st century, 40 years of Alma Ata. Of course, the organization also has well-established processes, frameworks, and methodologies for program planning, including setting programmatic priorities, joint monitoring, and assessment and reporting. And finally, the Secretariat has to make adaptations and changes to organizational architecture, and those are required to better support the policy itself, the policy formulation itself, but also to help countries better respond in the implementation of those policies. So this is a journey through our public health policy formulation. But in closing, let me go back to my starting point. Effective public health policy is about making a difference in people's lives. So the COVID-19 pandemic added unprecedented challenges to public health. But I think it brings tremendous opportunities for innovations, for rethinking the development of public health policy. And the vision does not change. The vision is still health for all people, universal health, equity, and the breaking down of barriers to access. So as I conclude, allow me to call you to action. So you are our future. You are the energy that will drive change. And really, the future is in your hands. I know this is often said, but I believe it. So I'm calling you to engage in the decision-making process and to make your voices heard. And if you feel you're not being heard, reach higher and farther and louder until all those that are not listening, until they sit up and pay attention. So seize this moment, as the actions we take now will have lasting impact for your health and well-being and that of your communities. So I challenge you again to be involved in public health. I challenge you to be involved in health action. Thank you again for inviting me.
Thank you so much, Dr. Etienne. That was amazing. I think as a student who is very passionate about wanting to cause an impact in Latin America and the Caribbean, but who hasn't learned a lot about public health, this speech was amazing to learning more what's behind that work. So thank you so much.
Thank you so much. That was extremely inspiring.
It was my pleasure.
So before we end our opening ceremony, after this amazing speech, we just wanted to go over some of the logistics of the conference. So this webinar will be where all of our panels take place on both days. And in between the panels, this room will remain open. We'll also have our panelist workshops and career Q&A sessions throughout today and tomorrow. But if you were assigned to one of them, you should have already received the link yesterday. And also you can check our agenda in the website and also in the brochure we sent to all of you.
Our first panel will be healthcare systems, but we will first go on a break right now, and then the panel will begin in 30 minutes.
Thank you so much again, Dr. Etienne.
Thank you so much and good luck.
Thank you.
Thank you.
Okay.